All right, let's go ahead and get started. Good morning, everybody. Thank you for being here today. Hello and welcome. My name is Dawn Snodgrass. I'm a communications analyst at the HCAI Workforce Development. We're thrilled to have you join us today for the HCAI and Health Careers Exploration Program webinar. And before we begin, we have a few housekeeping notes, but first we'll talk about the agenda. We are going to go over the Office of Health Workforce Development Health Careers Exploration Program Overview, HCEP program elements and key dates, HCEP application scoring criteria, program provisions, and then we'll have a Q&A session at the end, and we'll round it off with closing remarks from Wahida. Okay, so next slide, please. The housekeeping and introduction. This webinar is hosted in Microsoft Teams. If you're not familiar with Microsoft Teams, you can find the chat and the view controls in the menu bar at the top of your screens. And as I said, there will be a chat session at the end for Q&A. And so we will open the chat at the end of the session. And this webinar is going to be recorded and will be available within 7 to 10 business days. With that, it is my pleasure to introduce Wahida Nawad, Grants Management Section Chief, who will get us started. Wahida?
Thank you for joining us today. My name is Wahida Nawab, Grants Management Section Chief here at HCAI, and we will go into details about HCAI and Health Careers Exploration Program and overview. Next slide, please. All right, HCAI's vision and mission. Our vision is a healthier California where all receive equitable, affordable, and quality health care. And our HCAI mission is to expand equitable access to quality and affordable health care for all Californians through resilient facilities, actionable information, and the health workforce each community needs. Health workforce development is to support and increase a health workforce that serves medically underserved areas, represents the California it serves through racial and language diversity, serves Medi-Cal members, and it offers programs that provide financial support for organizations expanding educational capacity, individuals to pursue health careers, scholarship, and loan repayment, organizations to build the workforce pipeline. Health Careers Exploration Program, HCEP overview. Program purpose is to pursuant to the Health Professions Career Opportunity Program, Health and Safety Code Section 127885, and the Department of Healthcare Access and Information will consider applications for the Health Careers Exploration Program, HCEP, that supports and encourages underrepresented and disadvantaged individuals to pursue health careers to develop a more culturally and linguistically competent healthcare workforce. Our HCEP goals is competitive proposals will demonstrate a commitment to the HCEP goals by implementing one or more of the following components: conducting a conference or workshop series aimed at informing individuals of opportunities in health professional careers, providing support and technical assistance to health professional schools and colleges, as well as to students and community organizations active in minority health professional development, conducting relevant workforce research and data analysis in the field of minority and disadvantaged health professional development. Now I'll pass it on to my colleague, Elvira Sanchez, our program officer for HCEP program elements and key dates. Thank you.
Good morning, everybody. My name is Elvira Chaitis, and I'm the program officer for HCEP. And
Elvira, you've gone mute, or your camera's off too.
Oh, sorry about that. Okay. The proposals must promote the following health professions: primary care, behavioral health, caring for older adults, nursing, oral health, and allied health. Next slide, please. Okay, and the following is a list of the award categories. Award category A represents health career conferences and/or workshops. And this category focuses on introducing participants to a wide variety of health career options by offering health career fairs, experiences, and workshops. To be eligible for category A, the organization must support a minimum of 100 participants. The next category is B, hands-on experience in healthcare. And this category focuses on direct exposure of participants to one or more health careers through hands-on experiences that include direct interaction with healthcare professionals in real or simulated healthcare settings. To be eligible for category B, the organization must support a minimum of 50 participants. Next slide, please. And category A, the eligible organizations the HCAI will accept are from public and private nonprofit organizations within California. A nonprofit organization is an organization exempt from taxation under Section 501c3 of the Internal Revenue Code. HCAI will validate the organization's nonprofit status with the IRS as an eligibility component. And again, HCEP is open to organizations only. Individuals are not eligible to apply for either category A or category B. Next slide, please. For category A, we award $12,000 or $20,000 with a focus on behavioral health or caring for older adults. And in order to be awarded the maximum $20,000 in this category, you must have at least 50% in either of those fields. Again, a minimum of 100 participants are required. For category B, we award $15,000 or $25,000 with a focus again on behavioral health or caring for older adults. Again, at least 50%. Next slide, please. The key dates are as follows. As most of you know, the application cycle opened on August 15th. The webinar today. The application will close October 17th at 3 p.m. We anticipate the awards to be announced in early January 2026. The grant agreements will have a start date of February 2026. And these are just one-year grants, so they will end in January of 2027. We are going to now discuss the evaluation and application scoring procedures. At the time of the application closing, HCAI will review each application for the presence or absence of required information to conform with the application submission requirements. HCAI may reject applications that contain false or misleading information. HCAI will also use the evaluation criteria described in the grant guide to score applications. Next slide. And as you can see, this is really lengthy. I will not go through each of these. This slide basically lists all the criteria for program information, program proposal. We recommend you just go through each one and select whichever ones your organization is actually eligible for and will address within your proposal. Slide, please. This is a continuance also for program proposal. Just briefly, for program proposal, we ask how your organization proposes to be culturally and/or linguistically responsive to program participants. Next slide. More continuing of the scoring criteria, program information, program proposal, and program information again. Next slide. More program information, organization background. Next slide. And program proposal again. Program activities. Briefly, does the applicant program include any of the following activities? Over the years, we actually have expanded this list of program activities, so there is quite a range that organizations can select from. Next slide, please. More for the program activities. And the final slide shows again more program activities, mentorship, and academic support. There's a total of 172 points possible. That's the maximum for any application. Next slide. Okay, so the next few slides, we will go over the grant application processes. The application will include 12 sections: general information, program information, adding a partnering organization, adding program sites, percentage of health careers, program proposal, program objectives, qualitative questions, organizational experience, services, program budget, contract administration, and assurances. And the budget detail, we asked you to list the following activities, which include advertising, meals, supplies, transportation, facility costs, and indirect costs. Indirect costs cannot exceed 15% of the total grant amount. Next slide, please. Post-award and payment provisions will include HCEP expects the grantee to begin performance of the grant agreement on the start date listed on the grant award documents. The State Controller's Office mails a paper check directly to the grantee's address on file. And this is actually something that's really important. When you're filling out your application, we ask that you pay special attention to that section, which will be listed under the contract administration. And just make sure that you add a complete address. Your address must match exactly with what you have filed with the IRS. And this is to avoid delays in payments. And we also need a recent STD 204, which is a payee data record, and that is a mandatory document. Grantees must abide by the schedule of the deliverables. Special note, HCAI will not make changes to any terms and conditions specified in the grant agreement. If your organization is awarded but refuses to sign the required grant agreement documents by the deadline, you may lose your award. Extensions to this deadline will not be considered. HCAI reserves the right to recover monies for a grantee's failure to perform services and other grant agreement obligations. Next slide, please. Okay, so the Q&A will be handled by Dawn now.
Hi, everybody. I just realized I was muted. Okay, thank you, Elvira. We'll now transition to the Q&A session. So to ask a question, all you have to do is simply click the chat button in the menu bar and type in your question. We'll do our best. We've got some time to address some of your questions, so we'll do our best to get to address as many as possible during our time together today. If you have any specific, really specific to your circumstance questions, then if you could please email our team at hipcop@hci.ca.gov. We'll put that email in the chat and we'll have you do that so we can provide you with the most accurate information if you have something that's very specific to you and your circumstances. Other than that, let's get going on some of these questions. Okay. Karen asks, are current recipients eligible to apply this year?
Hi, good morning, Karen. Yes, you are eligible to apply again. But please note that your current grant agreement cannot overlap with a new grant agreement. So in other words, you cannot use funds from your current grant agreement to your new grant agreement if you shall be awarded. Thank you.
Thank you, Elvira. Okay, Jennifer asks, how do you define allied health? Who wants to take this one? Okay, let's move on we'll get back to that question. And we're going to move on to another question. When do we have to have the event done by? Is it January 2027?
Good morning, Talar. Are you referring to the Health Career Conference or Career Fair? I don't know if they can respond in the chat, Dawn.
Okay, so we do have the mics disabled right now. Talar, did you
Let
want?
me. I'll just answer generically. We don't really have a hard deadline for your events to be completed, but you must have you will be required to submit an annual report or a final report at the end of the grant term. So normally the grantees have their conferences, events, activities, whatnot completed within a month or so before the expiration date.
All right. Thank you again, Elvira, for your response. Okay, moving on. All right. This is from Joanne. Hello, I am a grant writer at my organization, and based on the role I assigned myself in the HCAI grant application portal, I am not able to access the HCEP application. I've reached out to HCAI. Okay, so this is more of a specific question. And again, I see that Joanne, you've already reached out to HipCop. We will make sure that we do address your question. And yes, so we will make sure that we take note of that and send you a response via our email. All right, moving on. So,
If I can expand on that, Don?
sure.
Yes, I am checking emails this morning. We've had quite a few emails I haven't been able to get to just yet, but I will work on those. And if you have completed your profile completely in the portal, then I should be able to find your name in our database and will grant you the program director status. And if not, I will respond to an email directly and correspond with you directly if there are any other issues with that. I hope that helps. Thank you.
Okay, thank you, Elvira. All right, Talar, did you get your questions answered? about the skills hands-on activities are acceptable. Does anybody speak to that for Talar? Okay, so Talar says that he still is looking for an answer to his question. So he's asking, what exactly do you want to see for the adult care criteria in nursing? Either conference or the hands-on activity. What skills hands-on activities are acceptable? And this came in at 10:20 from Talar.
Hey, it's over here again. Yes, it should be listed in the grant guide. Um, it's really actually left up to you if you'd rather do the conferences or the hands-on experiences. That is up to the organization individually.
Thank you, Elvira. Okay. Karen asks, will the links posted in chat be sent along with the recording of the webinar? I'm unable to access these links through the chat box. Okay, will the links be posted in the chat, be sent along? I think that we can do that. We can get the links to you, Karen, that were in the chat. I'm making a note of that. All right. Okay, Karen, we will address that. You're welcome. And Yuko asks, can one organization apply for both A and B?
Hi, good morning, Yuko. Yes, you can apply for both categories.
Thank you, Elvira.
Again, back to one of the earlier questions, they cannot overlap with either grant.
No overlaps. Okay.
Thank
Thank
you.
you. All right. Okay, Talar's got a follow-up. It says, I understand that it's up to us, but are there certain skills, hands-on activities that are not acceptable?
Laura
Anybody
again.
want
I'm sorry, I'm not really sure how to answer that. I can respond to an email and look into that further. If you can send an email to the HIPCOP email, please.
Okay, can we put the email in the chat? So if you have some questions that we're not addressing or we can't fully address today, again, please do send us an email at the HipCop email address. That is the hpcop@hci.ca.gov. I'll put it in the chat. Oh, Elvira's got it. Like Elma's
Yes.
got it. Thank you. Double thank yous.
Can I
Any
extend on
other?
that a little bit, Dawn?
Sure.
Sorry to interrupt. Since this email actually is also, or does also include other programs. So to make it easier and to avoid some delays in responses, if it would be really helpful if you can list in the subject line, if you already have an application number, please list that, and that will look like GA, I believe it'll be 24 HCEP -000 and then your number. If you do not have a number yet, then please list something like HCEP question, something that I can identify as HCEP. That would be very helpful. Thank you.
Thank you, Elvira. All right, we still have some time, folks. Do you have any questions? Any additional questions? I'm just going to pause for a moment, see if anything comes to mind. Okay, Talar again. For facility costs, are we able to pay for a venue within our organization? This is a venue on campus, but they charge. Does anybody want to take this question? Again, this is from Talar at 10:28 a.m.
Talar, I believe that if you are to be awarded, that would be a question that we can discuss after your award has been finalized. And you can maybe expand a little bit more on exactly what type of costs you're referring to. I think that would be best. Thank you.
Thank you, Elvira. Again, for specific questions, do email the HIPCOP inbox and we will respond. Will we post these slides? Yes, the slides will be posted, a webinar recording and the slides will be posted within 7 to 10 business days. Can you explain the 50%? Sorry, Karen. Oh wait, I missed one. Let me go back, make sure I get all the questions. Sonia asks, are ED programs eligible? Are ED programs eligible?
Hi, Sonia. Can you please expand what you're referring to ED programs?
ED meaning universities.
Universities are eligible. Yeah, that is listed in the grant guide.
Okay.
Universities, colleges, nonprofit organizations, for-profit organizations are not eligible.
Got it. Thank you so much, Elvira, for explaining that. And it looks like Clinton has put the allowable expenses for the grant guide in the chat. So take a look at that if that applies to you. Okay, going back up here. All right, Karen asks at 10:29 a.m., can you explain the 50% population breakdown requirement to get the higher grant amount? So what is the 50% population breakdown requirement? Do any of our panel members want to take this one on, or shall we take some time to think on this one and get back at a later time?
Sorry, Don. I think we'll get back to that in a little bit. Thank you.
Okay, so we're not able to address this question particularly. Again, do feel free to please email our HIPCOP inbox with any specific questions or if you need further clarification. Are we able to compensate our presenters and what are indirect costs? This is from Talar at 10:31.
Regarding the expenses, you basically are required to direct those as you best choose. If you believe that it's best to use them for presenters or meals or advertising, that's really left up to you. But just so you know, if you're awarded $10,000, you cannot go over the $10,000, obviously.
Thank you, Elvira. Clinton, you had put in the chat about 50% behavioral health or 50% caring for older adults. Were you addressing a question in the chat? If so, can you kind of expand on that?
Hello, everybody. My name is Clinton Ramsden. I'm the program manager. Yes, it's you. If you have 50% of the training is taking place in behavioral health or caring for older adults, or a combination of those two, that equals 50%. Like you could do the other activities, but you get a little turbo boost for points as long as you're specializing in those two specific categories. And it could be a combination. Like you could be a 30% behavioral health, 20% caring for older adults, just as long as it equals 50%. And that's just to give your score a little turbo boost, okay? It doesn't mean you'll be disqualified or nothing like that, just to give you a little extra points in the spirit of how this program was designed.
Great. Thank you so much, Clinton.
One other thing I wanted to add is for the folks out there saying that they're having trouble with the resources too. We do have these resources on our hci.ca.gov website. Okay, so if you wanted to take a look at that now, if you having navigation issues and you need help with that, you're welcome to send us an email. We will send you all that. But if you're able to go and look at the website, you could find it there, hci.ca.gov. All of these resources. Thank you.
Thank you very much, Clinton. Okay, got a few more questions coming in. Clint, we've got a comment that the grant guide isn't opening. Can we check that link? And okay, we have a question, and I'll go to Karen's just because it looks like a follow-up to what you were talking about, Clinton. So Karen says, so you could serve 50% primary care, 25% behavioral health, and 25% older adults, for example, to get the larger grant award. This question came in at 10:34 from Karen.
As long as it adds up to 50% in those two categories of your work, then yes.
Excellent, thank you. Okay, where will the slides be posted? That is a great question. If one of my colleagues can step in and answer that, Alma or Chris?
Hi, good morning. They will be posted on our website, on the HCEP page. That is also linked in the chat. It'll be under your resources.
So thank you, Alma. At the top of the chat, the very, very top, if you guys scroll up, we pinned the resources. So Alma has done that for us. Resources for HCEP. We've got the Health Careers Exploration Program Guide. We have the grant guide, and we have the email, and we also have the application dates posted as a reminder for everybody. So that is at the top of the chat. And thank you, Alma, again. Okay. Jenny asks, can grant funds be used for stipends or incentives for participants in hands-on experience in healthcare? This was asked at 10:33. Can grants be used for stipends or incentives for participants in hands-on experience in healthcare? Who wants to take this one?
Jenny, this is Zavir again. Yes, that's fine. But again, going back to the earlier question, you are able to use your funds however you see best suited for your grant organization. Your organization, sorry.
Questions? We've got some more time, folks, for your questions. If you have any additional questions, now is the time. Your question at 10:30. Thank you, Yuko. Let me go up and find your question. Okay, got it. Yuko asks, would it be allowable to apply separately for each college student health center? So it'd be grant A and B for Mission College Health Services and grant A and B for West Valley College Health Services. This question was asked at 10:30 by Yuko.
Yuko, I believe that would be allowed. Again, that would be a specific question if you are to be awarded. We can review your specific organizations that you're referring to.
Thank you, Elvira. Clinton, did you have something to add?
Yeah, just to add on to that. So to be helpful to you, okay, if it'll likely be a problem if you have the same federal tax ID, the FEIN, okay? If you have the same tax ID, then that might be a problem because the way our accounting work is if you have the same tax ID, it looks on paper like you're the same awardee, okay? So if you have a separate FEIN, it's likely going to be okay. If it's the same, it'll likely be a problem, okay?
Thank you, Clinton. Okay, Talar asks at 10:37 in the chat, are we able to make adjustments to the budget after the application has been approved?
Talar. Keep in mind that these are only one-year grants, so again, that would be a question asked if you are to be awarded. We may or may not approve budget modifications. You would need to send those specifically with your proposal versus your current expenses. So that is something, again, that we can address once, if and when you are awarded.
Again, thank you, Elvira. Okay. All right. Nanette asks, please confirm that public high schools are eligible.
Yes, they are eligible.
Public high schools are eligible. Thank you, Elvira. All right. Did I miss anything? Did I miss anybody's question? If so, please alert me.
Hey, Dawn, this is Elvira again. While we wait, in case there are other questions, I just want to point out a few things.
Sure.
I'm not sure that we discussed them earlier. One of the main things that we recommend is please do not wait until the deadline, October 17th, to start your application. This happens pretty frequently, and the reason for that is in case you're having technical issues. And if we do not have staff available to answer your application questions on October 17th, it's really to your benefit to start it as soon as possible. And if there are any questions, again, please send them to the HCAI email. Brief questions, please, addressing exactly what your issues are. And we will definitely get to those questions as soon as possible.
Absolutely.
Another issue is keep in mind that for those who are awarded, we use DocuSign. There have been some instances where some organizations have not been familiar with DocuSign or have refused to sign. So please keep in mind that DocuSign is used for all of our grant documents, which are mandatory.
Great. Thank you so much for that.
Okay, and
Okay.
one last thing. On the contract administration page, please make sure that you include the current contact personnel, their exact email address, and it is best to use a direct email address versus an organizational address. We've had problems with getting in touch with folks if they just provide a generic address. So please provide that and a phone number, a complete name, and make sure that the person you list on your grant application is the person that will be eligible to sign for the grant agreement as well as a signatory. And it is explained in the application as well. Thank you.
Thank you, Elvira, for those additional details. Karen, you had asked what time on October 17th is the application due? It is due at 3 p.m. It's a good time to remind everybody the application is due at 3 p.m. on October 17th. So what's today? About 5 weeks.
Hey,
Yeah,
this is Clinton. I would like to just add to that, okay? So that is our 3 p.m. is our official close date, okay? On the website, if you go on there, it may say 5 o'clock. The reason why we do that is we add a little padding, a little cushion to the time, because we do get instances where people try and turn in their application the last minute and they panic and they say, I need 5 more minutes or whatever to turn it in. That happens every once in a while, and that's the reason why the cushion is there. But 3 p.m. is the official time. So if you need a few extra minutes to finish, it's there. But the other thing is that, I wouldn't expect to get help with your questions when you start crossing 3 p.m. because when after the official cycle is closed, I mean, we're basically done for business. That is just a cushion for people to finish the last 2 things if they have to turn it in. But like Elvira had said earlier, please, this is a competitive process. Please work on your application early and get it turned in. And then if you have problems and questions, you can ask us and we're happy to help you.
Thank you so much for adding that additional detail, Clinton. Appreciate it. So let's get those applications in sooner or later. The team's here to help and assist with questions. If they are received in a timely manner, they can help you out. Any other questions?
I have another comment, Dawn. I just
Sure.
thought of this, which I have also been experiencing lately. Please, it's also advised to please do not CC the PCS email.
What's the
PCS,
PCS
that's the
email?
Procurement and Contract Services, HCAI. PCS staff do not respond to those messages. They do not handle our grant agreements. So you do not need to CC them as well. If you have problems, which either myself as the program officer is not responding to, you can then refer your question to the manager, Clinton. That would be after you would be awarded, if and when you are awarded. That would be very helpful. Thank you. You're on mute, Karen, Dawn.
Thank you. Thank you, Elvira. Any other words of wisdom, comments for a smooth application process from our team? From anybody want to speak to that? You guys have done an excellent job of providing some of the minor details that help the application process run smoothly. Anything that helps you guys out? Anything else from the team? Any additional questions from our audience? Just going to pause for a couple seconds here to see if anything comes to mind. Okay. All right. Questions? Going once, going twice. Okay, well, if nobody has any additional questions or additional comments from our team, then thank you very much for your thoughtful questions and your participation. If we didn't get to your question today, or again, if it's something specific or something that we kind of need to mull over, please send us an email at the hipcop@hci.ca.gov. We have put that in the chat. It's also pinned at the top of the chat for your convenience. So I would now like to pass it back to Wahida for our closing remarks. And a reminder that the application is due 3 p.m. the 17th. Wahida?
All right, I just wanted to take a brief moment to thank each and every single one of you for joining us today on our webinar, and we look forward to working with you. Thank you.
Excellent. Thank you, Wahida. Okay, so next slide, please. Okay, so we really appreciate everybody for being here with us today and learning more about the Health Careers Exploration Program. It's a very important program here at HCAI and part of our health workforce development efforts. We're very grateful for your engagement today, and we would really love if you could visit our website to explore our full range of resources, and we would really, really love it if you would follow us, engage with us on our social media platforms. You can contact us at, next slide, please. You can contact us at the phone number or email address provided, and we are happy to assist. Again, deadline is 3 p.m. October 17th. Don't wait. That concludes today's webinar. Thank you for attending, and we hope you all have a wonderful day. Thanks, everybody.